Hi folks, Chris here from Active Health. I hope you're all keeping well. If you've seen Pete's recent video, then you know that we've decided just to do the A to Z of informative chiropractic videos. So just to get a bit of information about you, information out there for you about some topics that you might not know too much about. So I'm on the letter B today. I'm not going to go for the obvious, B for back pain. I'm going to go for B for bursitis. Now, bursitis is probably a word and a condition that lots of people have heard of, but might not necessarily know what it is and what the signs and symptoms are and so on. So I'll give you a few little bits of information about it. So first of all, what is a bursa? So a bursa is like a fluid-filled sac found in lots of areas in your body, but particularly around knobbly joints. So areas, bursa that often get injured are around elbows, shoulders, hips and knees. Now the reason for that is because the job of the bursa is to help try and reduce friction around areas where there is a lot of movement, basically. So for an example, the knobbly bone here on your hip, because it's sticking out a little bit, any tendons moving over that spot is going to be producing more tension on the area. So the bursa helps to cushion that extra pressure and therefore prevent injury. Now most of the time the bursa do a great job and we're walking and moving around nice and freely and pain-free. However, sometimes a bursa can become inflamed, and the main two reasons for that will be, first of all, from repetitive trauma, but trauma could be something like repetitively kneeling down. For example, plumbers always kneeling on their knees, so that they often suffer with bursitis of the knee, or repetitive movement. So an example of that can be a carpenter who is sawing all day long, so the tendon is causing so much friction on the bursa that and the tendon gets tight, the bursa gets inflamed, and then they've got the problem there. So what are the signs and symptoms? First of all, the obvious one is pain. It can range from just a dull ache to a really sharp, severe pain. It can really restrict movement sometimes. Often when you wake up in the morning, or if you've been sat down for a while and then you go to move, you're really stiff and sore. Sometimes in bad cases it can be quite red and swollen. The first recommendation, if you think you've got a inflamed bursa, would be to rest it from the aggravating activity. Sounds obvious, but it's amazing how many people try and work through it. It's not going to work if you keep putting that friction or trauma on the area. It's just going to keep re-injuring it, so you've got to rest it. Ice is normally a good way to settle down the pain and reduce a bit of inflammation in the area, so you can ice it for 10 or 15 minutes every couple of hours, particularly in the acute stage. If you have a sudden onset of this kind of problem and you rest it for a few days, sometimes it can go very quickly. However, if it becomes a chronic problem that just doesn't go away, there might be something else that needs checking, which could be related to it. So I'll give you an example. We often see bursitis in the hip, which is actually called trochanteric bursitis, because it's not actually the hip joint itself, it's a part of the bone on the side of the leg called the greater trochanter, and that's where one of the bursas is found. Now, if somebody comes in with a low back problem and a pelvic issue, sometimes they can have weaknesses or tightening of the muscles in this area, and that tightness can actually cause more friction over that bursa. So until you've got the underlying problem sorted, the bursitis won't get better. So if you think you might have one of these kind of issues, or any other kind of new issues, to be honest, actually, please feel free to give us a call and hopefully book an appointment soon. So we're aiming to be back on the 1st of June, so we can start taking some bookings. We're going to be calling up anybody who was already booked in before the onset of lockdown and just offering appointments. Chances are we will need longer appointments with you guys, because where we haven't seen you for a couple of months, we're going to need to do a more thorough re-examination just to make sure that we're not missing anything, to pick up on any of these changes that might have taken place and might be causing these new issues. So just bear that in mind when you book in, and yeah, hope you're all keeping well, and fingers crossed we'll be able to start looking after you guys soon, and helping things get better again. Okay, thanks, bye.